I know it was distressing to me to see 20, especially 25 one day. That's way above my comfort zone. But it is not, as we've talked about, it's not unexpected. And we do know where those cases are. That is the other piece that we're trying to balance here, is us increasing our travel, increasing our contacts in a measured way, but us in public health being able to respond when we have clusters, where we have cases, making sure we can find those links and find people who are exposed so that they can stay away from others and we can stop those transmission chains. So that's the work that we're doing, and that's why we are, the reason we have that number of people is because we're finding people who are connected. And to me, it's a positive thing as well. It means we're doing that work. We're testing the people who need to be tested. People are paying attention to it. But it is cautionary to us that as we start to go out more, and as you recall, this is sort of as we're getting into the second week of the first incubation period since we moved to phase 3, that's when we knew we were going to start to see people, cases increase. I will also say that, many of those, a good portion of those cases are related to the ongoing outbreak in a long-term care home at Holy Family, unfortunately, both in staff and residents. And so, that is something that we are also very much actively managing.
Do you have a follow-up, Gordon?
Is there any way to know, like in terms of when we see the numbers bounce up and down, like how they're related to the, that kind of 65% of normal interactions? Is there a level when we see cases hit a certain point that we would know that we are going beyond that kind of, interaction that is sort of being modeled, that would give you some kind of comfort that we're not going to get, a big upswing?
Well, the modeling is not that precise in that you can't do it on a day-by-day basis, but we do follow it weekly. And so I was looking at the update of the model yesterday, and we still are skirting that line. We're right around the 65%. The RRT, the reproductive number, has been hovering around 1. What we talked about last time, when we have small numbers, and thankfully 20 is still small numbers given our population, and we need to remember that many of these are linked. So if we're seeing if it was 25 cases that were popping up in the community that weren't linked to either the Holy Family outbreak or other outbreaks, that would be more worrisome. But many of these are linked, and that's the work of public health to help us understand that and where we can find people and where we can trace them. So we are hovering around 1, which is sort of pushing the limits of where we want to be. So this is going to be our dance over the next few months, where we do what we can do, we travel, we have those social interactions, but we do it in a measured and thoughtful way so that we can find people quickly. So making sure we know the people that we're with, or that if we're in a restaurant or a nightclub, that we're able to contact people. And that helps us make sure that people know if they're at risk, so they can prevent transmitting it to the people they're closest to. But that is absolutely going to be our dance, if you will, for the next few months.